We'll be starting a saline lock as our first checkoff skill. With starting the saline lock, you'll also hear in the facilities it'll also be referred to as a HEP lock as well. We're actually starting a saline lock. It's not going to have any heparin in it, and a lot of times those terms are used interchangeably. They've just called it a HEP lock, but it will actually be with saline. So lots of times you'll have a kit. Sometimes you'll have to put your kit together. At this point in time, I do want to let you know you need to pay attention if you see an allergy or an armband. IVP dye, they might be allergic to betadine if you're using betadine for some reason. Do not use extremity. There's several reasons that they might have that band on. Always make sure to ask when you're starting the IV if there's any reason that you cannot use that extremity, just like when you're taking blood pressures. So if you didn't have everything in a kit, these are basically the things that you'd have to have. You'd want to make sure that you had something to clean it with. Maybe an alcohol prep. Chloropreps, the chlorhexidine is the preferred cleaning agent right now. It's got more antimicrobial properties, so that's pretty much what they would like you to use. That's what's coming packaged in our kits. Now, you'll also want just a gauze pad. That's all that is. It's kind of hard to see on here. This is a tegaderm, also called an obsite. You can see because it's going to be clear where you can observe the site. You need a tourniquet. Very important to ask on those allergies about latex allergies. Tape. Going to tear it in just a minute. You want an extension set, and we'll go over what those are in just a minute. And also a flush, a saline flush. And we'll go over that when we go over the initiating the start of it. So you'd want to gather up your equipment before you ever got started. You've also got a little label there if you needed it.